The month of February is Heart Health Awareness Month, and Memorial Hospital is dedicating this week to its cardiac rehab patients.
23 ABC's Daniela Garrido joining us in studio with the story of a patient who's currently recovering through that program. Daniela?
As February goes on, the community continues to raise awareness on the deadliest disease for women in the United States, heart disease. This week is for those who have overcome a heart attack and are in the process of completing the cardiac rehab program at Memorial Hospital.
This particular rehab program is the most active in our community, so I think that we're very fortunate to have the staff and the resources here to help many of our heart surgery patients recover, our heart attack patients recover.
For Leslie Minnie, hiking the trails of Kernville was something she enjoyed doing on her spare time.
I hiked every weekend. I didn't know that I had a heart issue and actually had a heart attack while I was hiking.
An activity that is now linked to one of the most shocking days for the active hiker.
The day that it happened, we had tried a new trail and I thought maybe it was just elevation. I wasn't breathing right. I had back pain. I was carrying a backpack. I excused everything away. I didn't think, how could it possibly be me? Because I was too active and too healthy for that.
Ignoring the symptoms for a few days, she soon realized something was very wrong. A couple days later, as she was on the treadmill.
I actually checked my Apple Watch, to see, and it kept telling me that I had inconclusive results and to seek medical attention. So I was like.
Now, 3 months since her heart surgery, she is back to working out.
Coming here absolutely gave me the confidence to know that I'm safe and that, that I'm monitored, that everything's okay, and that they're not going to let me do more than what I can do. And then they just built me up.
A place that is more than just a gym for heart patients. It's a community.
A very important part of the cardiac rehab is the interactions between patients. And they find that they have someone else very much like themselves that's gone through a very difficult illness, and as a result they bond and they have a support for each other.
But Leslie says this minor setback isn't going to stop her from doing what she loves.
Oh yeah, for sure. I will get back to hiking. Absolutely.
Patients typically start the cardiac rehab 4 weeks after surgery and continue for a year, but it can vary on a case-by-case basis. Dr. Tommy Lee says some patients choose to stay in the program past the year mark and become lifelong members of the rehab. Live in studio, I'm Daniela Garrido, 23 ABC News, connecting you.
Now to one of the big